The work is unrelenting. The patients keep on coming. They wait, and in some cases, the delays lead to deaths. Getting timely access to healthcare is critical for all New Zealanders. So why are our hospitals so stretched? Why are the wait times so long? And will the government setting targets actually make a difference? When are those targets going to actually improve the situation for New Zealanders?
It's going to take a few years.
Peter Jones has been an emergency physician for almost 25 years. He did a PhD researching ED crowding and says it happens because of what's known as access block. Put simply, there are no beds on wards for patients to go to, and the ED fills up.
It's always been a problem at all the major hospitals.
Is it any worse now than it has been?
Yeah, I think it's probably the worst it's ever been.
The Herald highlighted the case of Tony Knott, who collapsed and died in Middlemore's ED waiting room in 2021.
It just seemed impossibly chaotic and like there was no care, but he was one amongst loads and loads of people in the same situation, seemingly the same situation. Yeah.
I believe that in the same hour that Dad arrived by ambulance, that 28 other people had arrived in that hour, so it was completely overrun.
At the time, Middlemore's ED was in what's called a code red, or at capacity. An access block can cause this.
Access block is the creator of a busy ED. So if you can't get the people out to where they need to be, you can't get the new people in.
Jones says research shows if you turn up at a crowded ED where 10% of patients have been waiting more than 8 hours, the chance of death increases.
We know that there is potential preventable mortality if we get flow through our hospital system better.
EDs are now under pressure to hit targets, a scheme enforced by the last national government and introduced once again. The ED target aims to ensure that 95% of patients are either admitted to a ward, discharged or transferred to another hospital within 6 hours. Although Jones, who advises Health New Zealand, is at odds with the 95% target widely publicised as the government's gold standard. Is it feasible to meet that 95% target of 6 hours max?
Yeah, that's a really good question. I think we can achieve that for people we discharge from the emergency department. I don't think we need to achieve it personally for the people that are admitted to a hospital. There's evidence showing that if we can get to about 80%, that's probably the inflection point.
But that's the minister's target, 95. But you don't think we need to worry about that too much?
I think we need to work towards it. Like I said, Mike, we don't need to worry about a number. We just need to get the care right and the numbers will take care of themselves.
But from a clinical perspective, you think 80% admitted is good enough?
I led an evidence review for the Australasian College for Emergency Medicine looking at time targets for ED length of stay, and the evidence that's in the international literature suggests around 80%, 6 hours, okay, is achievable. But we're nowhere near that and we have to work towards it.
Jones says to get near it, the entire hospital system needs to function efficiently. 85% of all patients turning up at our hospitals are known as acute patients. This means those who suddenly need to be there, not those who have planned surgery. For example, an acute patient could be someone who's broken their ankle or someone who's had a heart attack. To what extent is getting them to the right place reliant on actually having more beds in our hospitals, more departments to have more beds and more staff?
Yeah, that's an interesting thing. Just building new stuff doesn't fix the longer term problems because the new place will just fill up. So just building stuff doesn't fix the problem, right? We've got to optimize the way we care for people.
Delays can be caused by the less obvious,
Like, how long does it take for the bed on the ward to be cleaned before the next person can come in?
to the more complex. Jones says in some instances, patients who can't leave hospital and return to living independently can remain on a ward for months.
There is an issue, I think, with getting people out of the other end of the hospital to free up beds for the new people coming in. They might need to go to an aged residential care facility.
And is there some
that sort of
block
thing.
with the aged
There
residential care
yeah,
as well?
there can be blocks.
And how long are some elderly patients remaining in hospitals because they don't have anywhere to go?
This can be weeks or months.
So how tough is it at the moment for you and your colleagues, Vanessa?
Oh, look, it's been pretty hard work. We've had a lot of presentations and it's been challenging at times.
Vanessa Thornton is an emergency physician at Middlemore Hospital.
What sort of capacity are we talking about at the moment just at Middlemore?
We saw, I think it was 122,000 patients over the last year, which is more than we've seen the year before, but every year we go up.
Will setting targets alleviate this problem?
The targets, I think, are just a part of the picture. So the whole system will contribute to a change in this target. That's across the hospital, but also in the community, in primary care, in acute clinics, and then obviously in discharging and how we manage people as they exit the hospital. So it's really just an outcome measure for a whole system of health, I guess.
Are you adequately supported at the moment, or do you need more staff and more investment in this emergency department?
So what I would say to you is if you came to me with money and staff, no hospital would say, take it away.
I mean, are there times when you and your teams are so stretched that it's difficult to function?
There's no doubt there are moments in time where we get up to peak capacity.
In fact, official information shows in October, 68% of shifts worked at Middlemore were when the hospital had an occupancy rate of 90% or higher. At North Shore Hospital in the same month, 100% of shifts surveyed were worked when the hospital had the same high occupancy rate. And staff at Palmerston North, Rotorua and Hawke's Bay hospitals were also significantly under pressure, with each hospital in the high 90% range for occupancy in October. Dr. Thornton says it'll be tough hitting the 95% target of admitting ED patients within 6 hours when the hospital's so busy.
That's obviously not being met at the moment though at Middlemore, right?
No, we're at about, right now, about 69% within 6 hours.
And is that a pretty good level to be at, or do you think
Well,
as a
look,
physician we could do better?
we want to be everyone's seen and treated and discharged in 95% of the time for patients, because that's better for patients, it's better for staff. All the staff are committed to that, but it's challenging for them.